Good afternoon, everybody. So we're closing with the best session of all. We have dermatology superstars here. They're all very famous. They're fantastic in the social media. So I invite all of you to check their social media websites because they're amazing. So the first one we're going to have is Dr. Attiya Haroon. She's a board certified dermatologist practicing in dermatology in Fresno, California. She's an expert confocalist. She also is very interested in vitiligo, but most importantly, she's very passionate about social media. And on her Instagram, she shares a lot of posts educating patients about dermatology. They're fun, but also very educational. There she is.
Thank you so much. Thank you so much, WCD and team for having me here today. I'm going to present my favorite topic, social media pros and cons. So this is exactly me right after passing my board exam. This is how I felt. I felt really victorious. I thought I have done everything to be a great dermatologist. But after practicing for a couple of months or maybe spending a couple of hours on these apps, I started having something called FOMO, a fear of missing out something. But was it a FOMO or was it a fact that I was actually missing out something? How many of you here have a social media account? Great. How many of you do not have a social media account? 3. How many of you have professional social media account? Okay, so let's talk about some facts about social media because it's very common to not have facts on social media. The average daily time in minutes spent on social media worldwide has increased to 63.3% from 2012 to 2022. Over 80% of people seek medical information online, and 90% of Gen Zs often turn to social media for medical advice. The popularity of social media platform has increased over the past decade with nearly 60% or 4.7 billion people worldwide using social media. Americans spend an average of 142 minutes per day on social media. More than 125 million Americans use social media to reach for health-related information. False information tends to spread 6 times faster on social media than factual information. That as little as 4 to 5% of derm-related content on Instagram is posted by board-certified dermatologists. Many self-proclaimed social media skin experts and skin influencers lack qualification. A study of 199 YouTube videos on topical psoriasis therapies found that the majority discussed natural treatments and only 28.1% discussed therapies with grade A recommended by the American Academy of Dermatology. The popular TikTok social media beauty trend named slugging, which involves slathering petroleum-based ointment on the skincare, creates risk of acne, milia, and increased potency of topical medication when layered. So what about derm and social media? Of all dermatology content created on social media platforms, content created consists of non-physicians 52%, physicians only 32%, of which 84% were derm and private companies. This suggests that much of the content currently circulating is not created by derms. There is a great study. I highly encourage all of you to read this article named Skin Influencers versus Dermatologists as creators of the top derm-related videos on TikTok. It shows most of these posts were educational, 34%, or opinion-based, 20.6%, but only 5 out of 97 videos were posted by board-certified dermatologists. Nearly 63% of top videos were posted by bloggers. Here's another interesting fact. Bloggers' posts had 2.4 times more likes than those of board-certified dermatologists. Sad, right? In addition to having 1.45 times more followers on average. This is a great table from that article. It shows, as I mentioned earlier, that board-certified dermatologist has 5.2% on social media accounts. Rest is all bloggers, which is high. But there are also other people like esthetician, entrepreneurs, stylists, and other people who are posting about skincare content on social media. There's another very interesting fact, if you can notice from this slide, is that paid promotion as unexpected was only 34%. However, unofficial promotion was 74.2%. This is a very interesting table which compares how which generations, according to their age, are more present on social media. This was actually a cross-sectional questionnaire study. There were millennials, Generation X, and baby boomers. As Dr. Rao mentioned earlier, some of the old generation are more interested to act maybe cool on social media, more interested. So this study was actually right that there was millennials, they were spending more times on social media, 21.6%, actually 38.5%. For some reason, Generation X was not as much interested as compared to millennials, but unexpectedly, baby boomers were actually more interested as compared to Generation X. It is also very interesting to see that not just their personal time, they were also spending professional time on social media. And if you see from that slide where I highlighted, if you compare millennials with baby boomers, there was actually not much difference between both of them. Which are the platforms which are used by most of the people? Most users use social media accounts for Facebook, Instagram, LinkedIn, Reddit, Snapchat, Twitter, WhatsApp, and YouTube. And if you notice, and if you're a millennial like me, you might notice there is no TikTok. There was a reason for that because most of those generation were involved, started with these ones, and that they wanted to see some answers, so that's why they didn't include TikTok. But as expected, a 62% millennials were on Facebook and followed by Instagram. As expected, most of them were using, and as it should be, social media from home, but they were also using work and during commute. So was I right or was I wrong? Dermatological medical advice on social media should come from reliable sources, that is like us. Dermatologists should be encouraged to use social media platforms. So that is a fact that I was missing something, right? So now I'm going to talk about, now I decided to use social media. So is it a good idea or is it not a good idea? So if you do not want to spend the time on the next couple of slides, I highly encourage to look at this slide. It's just a summary of pros and cons of social media with some evidence. So pros of social media. There's a whole list why we should use social media because it helps deliver healthcare, improve clinical knowledge, it helps interphysician collaboration, help recruit patients, strengthen doctor-patient relationship, increase patient education, increase access to care. Good tool for public awareness as well. So this article actually compared, does all these facts are right or these are just opinions? And they actually found that between all the generations, everybody agrees to some things and some people were upset or not agree to some things, but almost everybody agrees that social media platform can be used to increase patient education. So now we all agree that we can use this platform for education. So what's the point of doing that? There's a great article by Vajutra et al. In 2023. It states that social media may provide an opportunity to close health literacy gap by providing less complex patient education materials in a variety of formats, including videos, animations, and infographics. It is available for every demographic and is free of cost. So if you decide to use social media, what you should start educating about. Almost everybody thinks about what are we going to post. So I think I'm all of everybody here. I'm the one of the beginners. So I would suggest start with your passion. My passion is skin cancer education. And as a physician, I think it's my responsibility if I can create awareness where I can make a difference by diagnosing something early for patient. That's really important and it actually makes me feel better. So there are plenty of Instagram or TikTok or Facebook accounts which teach about skin cancer. There is one dermoscopy and there is one by a skin cancer doctor. He actually just got viral because of his amazing skincare education. These are all my colleagues. I'm pretty sure everybody here knows all of them. They are doing amazing job by creating these videos, not just about simple skincare routines, but also teaching about simple medical or common medical issues. KP, acne, or canker sores may be very common for us, or maybe very easy for us to diagnose, but we're creating patient education. They're doing a great job. Social media is also a great platform for debunking myths. All of us here know that biotin is not good for hair, but actually it's social media who created awareness for the public that most of my patients come to me and tell me we don't want biotin anymore because we saw those TikToks. No more Neosporin on your wound cares. Washing your hair once a week is actually not a good idea. So not just for education, social media is a great platform for growth. By growth, I mean, I put two examples here, Dr. Tia Paul and Dr. Fatma Fahas. They both started their Instagram or social media account first before they opened their own practice. And a lot of people know them before they started practice. So it's a great way of doing that. In a recent survey, 66 of the participants indicated that they went to dermatologists that they knew about, and 21% of the participants indicated that they knew about their dermatologist slowly from the social media account content alone. Dr. Kriti Mohan on Instagram, she's also a great plastic surgeon. She also creates a lot of educational videos, but lately she has also started teaching how you can be a great doctor, medicine, and be on the social media as well. So now we all wonder, is it really important, or if I've not created that stress that if you're not on the social media, if you don't have a professional account, that means you're not doing really well. So other people were thinking about that too. So there is an article or study that how much influence of modern social media on dermatologist selection by patients. This study looks into the phenomena, focusing on how it affects people's thinking when deciding which doctor to choose for their skin-related concerns. And of course, we know that Instagram is all about aesthetics, all about cosmetics, but what is looking good, what is not looking good. So most of the choice of the patients about choosing what problem to see for the doctor was actually for their beauty concerns. But if you notice, 43% actually through social media went to their dermatologist for a skin problem. So what was their preferred way to know more about their doctor? 94 out of 211 answered Twitter, 59% answered Instagram. But at the end of the study, they actually concluded it was not the social media, it was actually the old school method, which was through family and friends, which influenced a lot on choosing derm. So if you're missing social media, it's still fine. So platform for opportunities, you get paid for your post, for your reels, you get noticed, you can get clinical trial opportunities by a lot of brands as well. These are again one of my most famous colleagues on social media. Dr. Idris just started her own line. She has a huge follower on Instagram and TikTok. We all know that. Dr. Tomasian here, right next to his picture in Sarawak, in Costco, I think. So, and also Dr. Dermtalk, she's also mentioning that we're living my actual dream of as a dermatologist and having opportunities I have never imagined before. It's a great platform for connections. After COVID, almost all of us can agree that we don't have to be in Paris or Australia or Germany or to be in a specific time in a specific meeting to see somebody. You can actually connect to these platforms with the person you want to connect. I learned most of my derm path during my board exam to Dr. Gardner. He has amazing videos free of cost on YouTube. You can actually, if you're a new graduate, if you're looking for jobs, you have platform to look for the jobs on the social media as well. Not just us, not just physicians, but actually patients are also get a lot of benefits for their connection through social media, just like eczema or like psoriasis, or if they have early diagnosis of something which is a chronic disease, patients go on to those platforms and connect with each other and come up with a plan, or actually just feel better. It's just not them. There are other people who have the same problem as well. I talked a lot about good things about social media, but of course, when something is there, it also comes with some problems. So what are those problems? There is a list of problems of social media. Some of them it could damage professional reputation. Most important one is that breach patient privacy. Sometimes there are things which are not true. There is emphasis on superficial values. Sometimes it boosts non-evidence-based products, which I think most of the time is true. And it also allows for unqualified substitution of care as well. Not just that, there is another problem with the social media, which almost everybody talks about, is that how can it affect relationships? So it can affect relationship with family, with friends, but most importantly for us as physicians, it can affect your relationship with patients as well. So that was one of the biggest restriction and hurdle for me when I was thinking about my professional account. What if my patient is following me? What if it's thinking I'm making a reel like where I'm not just acting professional? So these problems are there, of course. And then the biggest problem, of course, there is no privacy, no boundaries. People ask you a question, no matter how many times you mention that this content is just for educational purposes. There's going to be a picture, a blurred picture with almost no history and physical exam, and they're asking questions about the diagnosis and management, of course. There's a huge risk of HIPAA. And I still believe with everything still going on and with so much going on social media, I could not find real guidelines as we are concerned about HIPAA. Whenever I take pictures, whenever I make reels about my patients, I always take consent. But is that consent enough? Because if you're using a picture, you ask them, I'm going to use this picture, and I'm going to use that image for publication, but we don't have any rules to share on social media. Anybody can share any picture anytime. And it's just not about how, even if I cut patient face, a patient can always be recognized through their jewelry or through their tattoo or something congenital. So it's still a problem, I think, at this point as well. And then, of course, mental health. There is a lot of talk about how social media can affect mental health, but I actually could only find a couple of papers which shows or give evidence how much it can affect. And I think it's about time that we should have numbers about use of social media and mental health. So this article has focused or has given results that frequent social media use was actually associated with increased alcohol consumption, drug use, tobacco use, increased sexual risk behaviors, antisocial behaviors, multiple risk behaviors, and gambling as well. And all those were pretty with a pretty confident intervals. And last but not the least, it's time consuming. It's another job. It's another full-time job. I know I started my presentation with a victory, and I'm ending my presentation with this very funny reel that we realized after going to medical school and then everything, that now we have to dance on social media. It's just for fun. It's not true. You can still make a professional account without dancing and educate patients as well. Thank you.